The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. This is the last episode for 2025. I cannot believe we've made it this far. If you're watching this on YouTube, you'll see it's the first appearance of my ears. I got rid of my over-the-ear headphones and I've put in some in-ear studio headphones. Joining me today is Dr. Justin Dubin. He's a urologist who trained at University of Miami and Northwestern. He's the host of the Man Up Pod. Dr. Dubin, thank you so much for being here.
Thank you so much, Steve, for having me. I'm really excited to be here. You do a great job with this topic and normalizing conversations around men's health, especially when it comes to testicular cancer. So thank you for doing what you do, especially from a patient perspective.
Oh, it's the honor of my lifetime to have the platform to do this. So today we're going to be talking about something that I see you dispelling a lot on Twitter or X, and that is misinformation, which is kind of rampant these days, especially with the internet, of course. So first we're going to talk about some testicular cancer specific topics, and then we'll get into general men's health misinformation.
Perfect.
So these questions came from Facebook, Reddit, and then off my own dumb dome here. So the first one is, can a pregnancy test really detect testicular cancer? Why or why not?
So this is an interesting question that's actually part of what I often, when I'm talking about testicle cancer with patients, I do bring up this idea of it. So in theory, it can, but there's obviously caveats. But to give you a background, pregnancy tests really detect beta HCG, which is human chorionic gonadotropin. That's why we say HCG, because I can still barely say the words over the last 10 years of my training. But so beta HCG is a very commonly elevated serum tumor marker. In fact, it's the most common elevated serum tumor marker when we're screening for testicular cancer, right? You're screening for three things: HCG, LDH, and AFP are the three typically blood markers that we screen for, HCG being the most popular. So it can be elevated in men who have testicle cancer, not everyone obviously, but it is also the hormone that is used to detect pregnancy in women. And that test, when they go pee, is testing a specific level that would signify potential pregnancy. So theoretically, you can test yourself or screen yourself or detect testicle cancer through a pregnancy test. Now, there are caveats, like I said. First off, just because HCG is elevated doesn't mean you have cancer. Second off, right, the sensitivity of these pregnancy tests is all over the place. So you can very likely or very potentially have a false positive, right? If it reads a positive HCG, you're going to freak out even if there actually wasn't an HCG. Or it can also have a false negative, right? Maybe your level is not as high as that threshold for it to be marked as positive on the pregnancy test. So, it may say negative when it's actually positive. But the bottom line is, and the most important message here is, you don't have to have a positive HCG to have testicle cancer. So anyone, who is concerned about testicular cancer, right? They feel a lump, a bump, a change in size. You should be talking to a urologist or a general practitioner. You shouldn't be doing a pregnancy test. So while it is possible, I definitely do not recommend anyone uses a pregnancy test to screen themselves for testicular cancer.
Very interesting. And speaking of HCG, even that's hard to say if you got a wet mouth like I do. But recently the Denver Broncos player who it came up on a blood test. Was that the HCG that was elevated in his blood test?
I can't remember. Typically, it's HCG or AFP. I didn't read too much into it. I was watching the game, what was that, Sunday night, and I was thinking about it because it's amazing. I think he came back after only about 4 or 5 weeks, which is pretty surprising. I probably would have recommended at least 6 weeks, but, these guys are unbelievable athletes. They heal quite quickly. I'm honestly not sure. I don't know if they disclose that. I'm going to read into it more. As you know, I've been traveling a little bit, so I'm trying to just catch up on a lot of stuff that's been going on. But it's a pretty remarkable story, and you guys should definitely try to get them on if you can.
Yeah, definitely. So the next question, so a guest recently was on the podcast, and he talked about, he had heard that you could put a cold can on your testicle, and if it didn't retract, that was a sign of testicular cancer. Have you ever heard of that? So
this is interesting. I have never heard of this. I looked up when you sent me this question. I actually looked into the literature on this one because I had never heard of like a failed retraction of a testicle to be a sign of cancer. And I couldn't find any data on it. And I think it's kind of hard, right? Because, first off, retraction of a testicle may actually be quite subtle, first off. So it can be subjective, and you saying, okay, this time it didn't go from here to here, it just moved a little bit. So I think first off, it's really hard to identify whether your testicle is retracting like fully sometimes, right? Even for me on an exam, it's sometimes hard when you induce a retraction of a testicle to actually see if it's doing what it's doing, and I don't know what the normal for that person is, right? So I think that's one issue with this. The second thing is I don't see how it would play any role, right? The cancer in your testicle is in your testicle. Most of the nerves and the muscles of your scrotum are actually very far outside. So unless you had really, really advanced testicle cancer that was like invading through your vaginalis, which is, one of the layers of your outside of your testicle, but still inside your scrotum. If it invaded through that and invaded into your cremasteric muscles, maybe it would be possible, but I think you would have noticed at that point. So I'm going to say that this is not true. So don't worry about your testicles retracting. Maybe you should worry about it, but don't worry about it in terms of being a concern for cancer.
Gotcha. Okay. This next one I see is kind of one that I think I've seen you responding to a few times on Twitter X, and that is the frequency or infrequency of ejaculation having an impact on cancer, whether it's testicular, prostate, or whatever.
Yeah, so this is an interesting one. There was a study that came out, at least in prostate cancer, showing ejaculation frequency may be associated with risk of prostate cancer. I believe the paper said if you're ejaculating at least 21 times a month, it's associated with a decreased risk of prostate cancer. I looked at the data for testicular cancer, and to my knowledge, there's been several studies looking at this, but they have not been able to identify ejaculation frequency, whether you're ejaculating a lot or not ejaculating at all, as a risk factor for testicular cancer. Now, we know the standard risk factors include cryptorchidism, which in layman's terms is an undescended testicle. Whether it was brought down or not, you are at higher risk for having testicular cancer. And as a reminder, especially for those who did not have their testicle brought all the way down or have a undescended testicle, you can feel it sometimes, you can't feel it other times. Even if you don't feel abnormalities, that's someone you should really be getting screened or at least getting examined or consider an ultrasound on some kind of basis to establish, what it looks like, where it is, because it's very hard to examine, if not impossible to examine in person. So you wouldn't be able to identify those lumps or bumps or size changes that you typically would as a first sign of testicular cancer. cancer. You also have family history, obviously personal history. If you have a history of testicular cancer on one side, you're at higher risk for having testicular cancer on the other side. And I'm sure we'll go into the other things, possibly marijuana usage and things like that. But as far as I am concerned, ejaculation frequency is not associated with testicular cancer in any way.
Got it. Okay. And you segued there. So let's talk about the evidence or lack of marijuana, vaping, or alcohol increasing testicular cancer risk. I know that sometimes people say that smoking marijuana or edibles can raise that HCG and cause, concern in a surveillance state. But what about before that, like the cause of cancer?
So it's very interesting because marijuana in general is considered pretty safe in terms of cancer risk, except when it comes to testicular cancer. There's actually been several studies showing an associated increased risk of testicular cancer with marijuana use, particularly in the kind of testicular cancer called non-seminomatous germ cell tumors, right? Seminoma versus non-seminoma, I'm sure you've gone through that a lot in this podcast. Typically, non-seminoma may be a little bit less treatable or sensitive to chemotherapy and things like that. So obviously, maybe the less favorable of the testicular cancers is associated with marijuana usage. In fact, it's also associated with the frequency and the length of usage. It says that cannabis usage currently, if you're using it, can double the risk of testicular germ cell tumors, and also long-term usage can also, like over 10 years. Heavy usage is associated with increased risk. Heavy usage, by the definition that I saw, was using it at over 50 times in your life. And what's crazy about it is that marijuana's it has a strong enough association, or marijuana usage has such a strong association with testicular cancer that the American Society of Clinical Oncology guidelines actually acknowledged it. They said the association between cannabis and cancer development remains unclear, except for a possible link with testicle cancer. So it's really interesting how, whatever it may be, testicular cancer seems to be that outlier in where marijuana consumption may actually increase your risk of getting cancer.
Interesting. So when you say like the double the risk thing, so we say at TCAF or TCAF, 1 in 250. So that would be 1 in 125, which is still relatively rare. It's not like 1 in 10, but I mean, increase, but not crazy.
Hey, double's double, right? Double's double, but you're right. There's relative risk. There's absolute risk. There's ways to look at it. And you're right. I don't think that you should be like, I'm going to get cancer if I smoke marijuana, because I'll tell you, I have a lot of patients who have testicular cancer, and a lot of them don't smoke marijuana. It's not like everyone who comes in is smoking marijuana. But you also need to understand that this is a modifiable lifestyle factor that you can adjust for. And now some people may say, well, the average age of testicular cancer is is for younger people. Maybe I'll start smoking marijuana heavier in my later years. Take that information with what you will. I mean, but I think the importance here is knowledge is power, and you have autonomy over your body. I'm not telling you to not smoke marijuana, to smoke marijuana, but there is data suggesting there is an increased risk. Now, you're right. When I do say double, that doesn't mean like you're doomed. You're definitely getting cancer if you use marijuana. I mean, I can tell you a lot of people, we all know a lot of people who've smoked a whole bunch of marijuana and continue to smoke marijuana who don't have testicular cancer or never had testicular cancer. But when you look at the data, it is quite compelling, showing that there is an increased risk.
And I've never smoked it, and I got it, so you're doomed either way, potentially.
I think that's a great point. I think that's a really important point, right? Because and it goes to the ejaculation stuff for prostate cancer. Is this thing going to make or break me getting cancer? And I think in the end of the day, it's probably not, right? I think the cryptorchidism, the family history, other factors that we're going to talk about as well, play an important factor, but when you cumulatively, you're increasing the risk, right? You probably have a genetic risk factor already, and then the smoking, the marijuana may just kind of expedite that or bring it out. But yeah, I think that's a really, really important point. I can't tell you whether smoking marijuana caused it or didn't cause it, and we'll probably never be able to tell that. But like you said, you never smoked weed and you still had it. So.
And then the next part of that question was vaping, which it might be too soon to tell about that. I mean, this is a relatively new fad.
So we'll go back, though, because cigarette smoking is actually associated with increased risk of testicular cancer. Also, there's a dose-dependent relationship, about 2 times higher risk as well. Dose-dependent, just like marijuana. But when it comes to vaping, we may be too early. You're right. I mean, there's been several bigger epidemiological studies with larger populations, but there's not been any conclusive evidence suggesting that vaping increases your risk of testicular cancer. Now, in general, though, vaping does have a lot of other negative effects. I always recommend stopping it for fertility evaluation. A lot of your listeners probably who have gone through the testicular cancer process are concerned about their fertility and have probably had a fertility journey if they haven't had one or planning to go through that. And obviously vaping is not really helpful. And when it comes to cigarettes, marijuana, diet, all these things, like even the ones that don't have data supporting the idea that they're not causing it. I mean, if you have these things, lifestyle is just generally important for the recovery process, right? You're healing worse if you're vaping every day, if you're smoking cigarettes every day. It's just not good for you. The recovery process, eating healthy, exercising, these things all go a long way to get you back to your baseline. So even if vaping really doesn't cause cancer, it does a lot of other bad things that I think it's still not good to be doing.
Yeah. And then the last part of that is alcohol, which I think for a survivor, maybe it would be wise to cut back, because one of the things, and I don't drink, but one of the things I'm concerned about is like nephrotoxicity, having had the chemo go through my kidneys. So, I mean, does alcohol increase risk of cancer or maybe even a secondary cancer for somebody who's been through it already?
I'll be honest, I do not know. I didn't look this one up, so I'm gonna just abstain from commenting on this one. I'm sorry, I don't know, but I do want to quickly mention. You bring up a good point about the chemotherapy and nephrotoxicity. A lot of people take bleomycin, which can also compromise your lungs, right? So, obviously smoking and vaping and marijuana, smoking these things is not going to be ideal for anyone who struggles with the pulmonary side effects of the chemotherapy that they're undergoing. So just another layer to what you're saying.
All right. So the next question is kind of off the testicular cancer topic, but maybe more in general. Are doctors or hospitals financially incentivized to recommend certain treatments in testicular cancer or men's health in general? Like, do you get more bang for your buck giving chemo when it's maybe not necessary?
So this is an interesting question. And before I answer, which I have my answer already set up, I'm just interested in learning from your perspective. Is this something that is believed to be true in forums or Facebook or Reddit? Like, is this something that's commonly believed? Just because, I mean, you hear these things like big pharma and stuff like this. So I'm very intrigued by where the question is originating from.
I would say that this is not something that I see commonly, and when I do see it, it is very well defended by most people. But it is one that I've seen you go to war on Twitter and X.
Yeah. So, I mean, from a urological standpoint, I can't think of any situation where I'm incentivized to do one thing or another. The standard of care is an orchiectomy for testicular cancer. There's obviously different scenarios, and even in the last 5 to 10 years, testicular cancer algorithms have gotten incredibly complex, right? And with increased complexity due to options in treatment, new versions of staging, and understanding how one stage can benefit specifically for one treatment or another. I think it's very difficult to say, first off, sometimes what the right answer is or isn't, because there's sometimes multiple right answers, right? And hopefully you as the patient have autonomy, and it's a conversation you're sitting down with your oncologist and your urologist if you're requiring a consideration for an RPLND or some kind of something like that, in addition to chemo or radiation. But from a urological standpoint, absolutely no incentive. I am here at your service. I see a tumor in your testicle. I'm taking it out, right? Like, that's very clear. There is, from my standpoint, no incentive for someone to offer surgery versus chemotherapy versus radiation. Like I said, we have very strict guidelines that gives us a pretty set algorithm on what to do and what not to do and what's indicated, what's not indicated. And I don't think that there's any financial incentives in any standpoint, right? Because first off, I'm a surgeon. If you need chemotherapy, I don't have any other surgeries to really offer you, maybe an RPLND, but if there's not even there, like, what can I do? I can't do anything. I need you to see an oncologist to get chemotherapy. The chemotherapy options are pretty standardized. Now, obviously, depending if you're going to an academic institution or private institution, you may have options that are new, there may be a study going on that you may want to participate, but the physicians are not getting paid really to do that study, right? They are getting the financial support to provide that as an option with for their patients who are interested, because trials cost money. You need to monitor patients. You need to check them a little bit closer than you would in a standardized accepted protocol. But yeah, I don't see any way in which doctors are incentivized to choose one treatment over another, especially anything in cancer, especially testicular cancer, where it's a real team effort, right? You do have an oncologist, you do have a urologist, and you're working together to figure out what the best mode of treatment is. And oftentimes it's a combination of both.
I guess maybe the one place where there might be question would be with a prosthetic, but I think that's largely just up to the person and their body image.
Right. So the prosthetic, once again, I offer it to everyone, and I'm not making extra money on it. I just think that everyone deserves the opportunity to be asked that question. And if I'm not someone, my stance on when I'm offering a prosthetic is I say, hey, listen, while we're in there, we can offer you a prosthetic device, testicle. I'm going to make it look and feel as much as I can as the other side. It's completely up to you. If you want it, we will do it. If you don't, that's okay too. And if you don't want it now, you can always get it at a later time. And, I would say about 50% of my patients do it, and 50% don't. And there's no wrong answer. And I'll be honest, I think most people don't even offer the prosthesis that I know. And I think that we need to, I've been vocal about making sure we offer it. So I think that I've never seen someone or a patient or a doctor say, I'm always putting a prosthesis in because I'm going to be making more money that way. I think that's crazy if that did happen. And like I said, I don't know, you've seen a lot more patients who have gone through this post-operatively. Obviously, I have my patients, but have a great network. I don't know, what percentage would you say have a prosthetic versus not prosthetic that you've met?
I would say the odds or the chances of somebody having a prosthetic is much lower than it is for somebody to wait. I'm confusing myself. Less people have prosthetics than do, that I know.
Yeah, right. Most don't. Most don't. And so I think that claim really doesn't make sense then. So if everyone walked in and everyone had a prosthetic and people came saying, I regret getting this prosthetic, I never wanted in the first place, maybe there would be a case. But most people actually don't have prosthetics. It's either because they weren't offered it or they decided not to. And like I said, we're really trying to make sure. And if you are a patient listening to this and you're you haven't undergone surgery yet, make sure you bring it up if your physician hasn't brought it up, because it is something, if you want to have, that you deserve to have, and we can do for you.
Good to know. All right. So the next couple questions are testosterone related. And first, before we get into the questions that were submitted, testosterone sometimes is confused between seeing an endocrinologist or a urologist. Who should they see for that?
This is a great question. And the answer is, it kind of depends. I mean, I think that urologists for men in the men's health space should be the harbingers of testosterone. I think that we are, a lot of us are, I mean, I'm specialty trained, I'm fellowship trained in its management, and there's a lot of urologists who are trained in, I mean, most urologists are trained in it, but so are endocrinologists. I do think that from historically, I think that a lot of the endocrinologists prefer to send their TRT patients to a urologist, but I also think that it depends, right? It depends on access to care, right? There's a lot of people out there who don't readily have access to a urologist, may have access to an endocrinologist, or they may not have an access to a urologist who provides TRT, right? Because some may not. And I know that I have a lot of patients who were treated with endocrinologists for years, who are still getting their TRT and seeing me for other men's health issues. And that's totally fine. So my answer really is, it's up to you. And some endocrinologists will say, hey, I'm treating your diabetes. I don't want to deal with TRT. Go somewhere else. Some will say, I'm happy to take it on. Most urologists are happy to take it on. So I think it's a complete preference thing, because I can totally understand if you're like, hey, listen, I go to the endocrinologist every 3 months already. Let's do a 2-for-1 special here. They're already managing my diabetes. Let's have them manage my TRT. But if you're getting older and you're going to see a urologist anyway, maybe it's worth changing over then, which I've had happen a lot. But a lot of the younger guys, I think, prefer a urologist, because I think we're just more comfortable addressing a lot of the sexual health concerns, right? And that is one of the benefits that seeing a urologist for your TRT does, right? Because we're going to address your testosterone, but having a low testosterone can be, part of a bigger problem, right? You may have sexual health issues, you may have ejaculatory issues, erectile dysfunction, fertility issues. So there's a lot of other things that may need to be addressed in the men's health sphere. And if those are concerns of yours, I would think you're better off going to see a urologist who can kind of tackle them all.
There are so one thing I will say that I see a lot of in the Reddit and our Facebook group is that a lot of guys feel like they have to kind of fight to get their testosterone. And Dr. Helen Burney is a friend of TCAF, and we always kind of refer to her when somebody has a question. But I mean, it seems like there's a lot of stigma around testosterone. Yeah,
first off, Dr. Helen Burney is an amazing person. She's an amazing urologist. I can't speak higher enough of her. She's truly a wonderful person. I always love running into her and learning from her. She's just fantastic. So I wanted to give her a quick shout out. Yes, testosterone is stigmatized. And I think we've reached a tipping point that it's kind of interesting, where I think it's more stigmatized by the older physicians than it is by the actual patients, because there's been probably in the last 10 years, a lot of these older physicians, whether they're primary care or they're, family medicine, or maybe even some of the older urologists, like really old urologists, are like, oh, you don't need that. That's nothing you need. And they don't know the data and they don't know the new practices. And I think that lack of understanding creates a stigma of not prescribing it or not referring to the appropriate people. So my answer to a lot of men who are interested in learning about their testosterone is, if your primary care provider isn't giving you the information, doesn't want to do the workup, your family medicine doctor or your urologist, which at this point I very, very much doubt is the case, at least for the urologist, ask for a referral. Say, hey, can I go talk to my urologist? Can I go talk to an endocrinologist? I just want to learn more about what's going on. And if you're not comfortable talking about it, that's okay. Send me to someone who is. And I think a lot of guys are starting to come out of the woodwork wanting to learn more, especially men with cancer or men with a history of cancer, right? Because having a history of cancer, you're at a significantly higher risk of having low testosterone. So it's something that needs to be addressed and should be addressed. And I recommend anyone with a history of cancer getting a baseline testosterone level just to see where they're at. Now, remember, if you're on your fertility journey, and we'll go into some of these things later on, taking Real Deal TRT is not a good option for you. But there are alternatives that we can provide that can increase your testosterone, make you feel better.
This next question, I don't know if it's exactly the right way to ask it, but somebody asked, are over-the-counter testosterone boosters safe, and do any of them actually work? I don't know that you can necessarily get testosterone like on the shelf at CVS, but I mean, maybe we'll say like just a men's health clinic that you see advertised on TV or something.
Well, those are two different things. So I actually understand this guy's question. So the question really is, are these testosterone supplements at like GNC, other pharmacies, even on Amazon, do they work? And the answer is, it depends sometimes. I think the most important thing is you understand that all supplements that are sold over the counter are not FDA regulated, which means that they do not need to prove the product that they're selling you is the product that they're selling you. So there can be a lot of artificial things. It can be completely BS. It can be one thing that they're giving you another. And there's good data on this, right? There's a lot of these testosterone booster blends products, and they've done studies on them showing that Real Deal testosterone's in it, like Viagra's in it, Cialis. So obviously you're going to feel good because no one's regulating these things, and there's these crazy products that actually work, but they can potentially be dangerous. I mean, I've seen guys who have stopped testosterone therapy or were interested, and then they went from a testosterone from 100 to 1,200, and I said, what were you taking? They go, oh, I just used this GNC product or some kind of like supplement. I was like, Jesus, that really worked. He's like, yeah. And I was like, I don't know what's in it, but it's doing its thing. Now, just because it works doesn't mean it's good and doesn't mean you should take it, because like I said, I have no idea what's in these products, and that can be dangerous. So what I do recommend is, if you're interested in using these products, using a single product, not these testosterone blends, right? So like a single supplement, and then you can make your own kind of blend. And there's some data suggesting some of these work, right? One would be Tonkat Ali. There's really good data supporting that works, increases your libido, your energy, your testosterone. Take it about 200 milligrams daily. Ashwagandha is a pretty popular one that I think a lot of people have heard about. There's ashwagandha gummies. It lowers your cortisol levels, which can increase your testosterone levels. So it can help you really decrease stress, improve your focus. You can take that about 300 to 600 milligrams a day. Then you have boron, which is like a mineral. It can increase your free testosterone. You can take about 6 to 10 milligrams daily. And then there's Korean ginseng, which you can take about 1 to 3 grams daily. Now, remember, it's important you talk with a provider, you talk with about, like, maybe they have a good recommendation of which companies are good, that have good products. And that's kind of the key here. But, is this going to be the solution for someone who has medically low testosterone? Probably not, right? Like, I don't recommend guys who know they have low testosterone or feel like crap just go to the store, pick up these supplements, see how it goes without seeing a doctor. I've had guys come to me, I diagnosed them with low testosterone, they're interested in these natural supplement pathways. That's fine. I give them exactly what I gave you guys here, and a couple other medications for erectile dysfunction, stuff like that. There's other supplements that can improve those things potentially, not for everyone. And And then I follow up in 3 months, and maybe we talk about the real deal tea after that. But, I think these are good options really for people who have a good testosterone, really want to optimize, right? You hear the word optimize, improve their testosterone levels maybe a little bit more. But I think for someone who's truly medically has testosterone deficiency, I think you're going to probably need something in addition or something better than that.
Interesting. All right. Well, I stand corrected. I didn't know they had these at GNC and places like that.
Yeah.
You brought up the FDA, and this is kind of a touchy subject nowadays, but we live in a time where like there's a lot of distrust in these organizations. So what are your thoughts on that, if you're even open to sharing?
Honestly, it's hard. It's really, really hard. It's hard when politics get involved with science, which has been since the COVID pandemic, right? It's the first time like we really saw a pivot where science and politics were intermingled. Science shouldn't care about your feelings. Science shouldn't care about your opinions. Data is data. Data should not be manipulated one way, or data should not be presented one way where it's not that. It's hard. And I think that there's a lot of different voices talking a lot about different things and different causes of things and things that are true, things that are not true. And I don't think, and here's the thing that I think is one of the problems, is I don't think everyone's always right and everyone's always wrong, right? Like what a person says. Yeah, first off, a doctor's probably right. I'm not going to lie to you. Like, you got to figure out a doctor's doing the training for a long time, but there are other people who may be right sometimes and may be wrong other times, right? You have a lot of influencers in the medical space. Most of them times, it's bullshit. But, people can be correct half of the time. They can be correct 10% of the time. That doesn't mean that they're always right. I think the key for all of this is that it's very difficult, even for a lot of very smart people, to decipher information. So when in doubt, just go find a resource like a doctor, right? Before you take any medication, try anything crazy, purchase some crazy ass product online, go talk to a doctor. It's just that easy. You're saving yourself time, money, potentially reducing your risk of harm, especially in the cancer space, right? You shouldn't really be listening to anything that's going to delay you seeing a doctor and getting appropriate care.
I agree. All right, so let's go back to testosterone. What misinformation do you see about testosterone therapy that can actually put men's long-term health at risk?
So, in general, I don't think there's many, honestly. I think testosterone in the right patient, in the appropriate patient, is a very, very important medication, right? In order to be diagnosed with low testosterone, you have to have a testosterone, low testosterone times 2. The number that the AUA uses is 300. We know that's not exact anymore. There's some flexibility there based off of age, based off situational stuff. So, you need someone to talk to for sure, who's a professional who manages testosterone frequently. And then signs and symptoms of low testosterone, right? Low energy, low libido is the most specific one that really signifies, that is most accurate in detecting low testosterone. But guys, some have normal libido and have other signs that like breast development, weight gain, osteoporosis, osteopenia, which is, bone health issues, body hair and facial hair loss, erectile dysfunction, low motivation, mood changes. So there's a lot of generalized signs and symptoms of low testosterone, but putting someone on it has shown to really reduce your risk of cardiovascular issues, heart attack, stroke, reduce your risk theoretically of potential, bone health issues, fractures. There's good data even preoperatively having a normal testosterone for orthopedic surgery. If you have an injury, it reduces, having a normal testosterone reduces your risk of complications of infection, gets you out of the hospital, faster recovery. There's so many potential benefits of being on testosterone, especially if you have low testosterone, that I don't really foresee any long-term issues. Now, there's controversy of whether it causes cancer. There's no data suggesting at this point that it causes prostate cancer. In fact, there's some newer data suggesting it may be protective against prostate cancer, having normal testosterone levels, and some other endocrine disorders and endocrine cancers. I think the biggest thing you have to always look at is keeping your levels in normal, in a therapeutic range. If you're going super therapeutic, yeah, of course there's risks. There's good data if people are living in these like super God levels, yeah, you may have an increased risk of heart attack, stroke, mood disorders, back knee, hair loss, stuff like that. But in general, if you're getting treated in a therapeutic way and you're in goal range, these are not issues. The biggest issue is testosterone is an anabolic steroid. So it builds, it adds muscle and helps growth, right? So your bone health we talked about, but it also increases your red blood cell growth. So theoretically, it can increase your blood thickness to create a clot. Now, this is all theoretical. There's, but what we do, we just keep track of your blood thickness with a blood test every 6 months or so. If it's too high, we make adjustments to the medication. We can have you donate blood. But that's about it. I think in general, though, as as the stigmas of testosterone usage have gone away and our knowledge and our research has increased on the topic and on the medication, we've really understood that there's so many benefits to using it. So if you're a guy out there and you're struggling with low testosterone and you're concerned about all these potential bad things that you may hear, I think it's time to go talk to a doctor about getting treated.
What would you say to somebody who's had orchiectomy on both sides and is not taking testosterone? Is that crazy?
I am shocked if that's actually a thing. I've done several of those cases, right? And actually, first off, appropriate counseling is really important, right? If you're a guy, you have one testicle, and then you found to have cancer in the other testicle, and you're going to be have no testicles. I think the first thing we often talk to you about is the need for testosterone supplementation. In fact, every time that I've done this, we've ordered the testosterone to be injected in the post-operative space right after the surgery. They get their first injection in the hospital before they leave. I teach them, or a nurse teaches them how to do it, and then they're on their way with testosterone prescription, not subscription. I guess it could be subscription, not really. But I always get those words confused. But I think that you're doing yourself a disservice for sure. You probably feel like shit, to be blunt. Your energy's probably lower, your libido's lower, probably may have a little bit of erectile dysfunction, your focus may be off. Having castrate levels of testosterone is really not good for your heart. It puts you at higher risk for heart attack and stroke. Bad for your bones, bad for your muscle, bad for your overall quality of life. And there's really good data on this. So if you are one of those few men, maybe you ran out of testosterone after you had the surgery and you just never went back, you really got to get on it, because I guarantee you it's going to change your life for the best. And being off of it is actually higher risk than for health issues than being on it, for sure.
Interesting. Okay. So this next one is, if a patient follows bad advice and delays getting checked, how much can that change their testicular cancer prognosis? Now, I think everybody listening to this has already been affected by testicular cancer. Yeah. So maybe this is a recurrence or, other testicle having symptoms scenario. Yeah.
So I think it's the same scenario either way, because the truth is, delaying care, especially in any cancer situation, can be very problematic. Now, fortunately, testicular cancer, as you and all your listeners know, has an incredibly high cure rate, right? It is wonderful how high, most guys who come in get treated. Even if with metastatic disease, they get treated and they're cancer-free, or they're walking away cancer-free by the end of it. Now, the difference, though, is delaying your care, and delaying your care inherently becomes what you're going to undergo, right? I mean, we have a classic story of a guy who feels a lump 2 years ago and does nothing until it's so big that it's just annoying him. He goes to the doctor, he has cancer, and now he has retroperitoneal lymph nodes. And instead of just having an orchiectomy to get the surgery, he now needs to undergo chemotherapy and maybe an RPLND. So
who would do that? Not me.
Did you actually do that?
Yeah.
Sorry, I didn't know your story. So that actually
that's okay.
But it's the classic story. But I'm sorry. But it is the classic story, right? That you're not alone. And this is something we see all the time, right? And so early detection is key, not because it's going to cure, you're not going to die or not die, because I think most people you're going to live no matter what. But it's really key in reducing the harm that you're going to get done to yourself, right? So the delaying the inevitable increases your harm, right? And by harm, I mean, you still have to get treated, but there's higher side effects, right? So, you have an orchiectomy, sure, just getting your testicle out is not pleasant, but typically if it's contained to the testicle, low stage, you're done. That's it. Just monitoring. But if you wait 2-3 years and that spreads to your lymph nodes, you just bought yourself a chemotherapy regimen. You just bought yourself maybe an extra surgery, an RPLND. Side effects we talked about already. There's nephrotoxic. There's, lung issues, fertility issues, ejaculatory issues with RPLND. So you're buying yourself a lot of additional side effects that could have been prevented with earlier detection. And, especially someone who had testicular cancer identifies another mass on the other testicle. Obviously, that's very scary because you've already gone through that process. And, ignorance is bliss sometimes in the beginning of this. You're just like, oh, I got this thing, I'll go through it. And then, you come out the other end, you're like, holy crap, that was a lot. And now having another lump, maybe you're scared to address it because you've already been through that process. But just know, delaying it may make that process a little bit more cumbersome, right? You're putting yourself at higher risk for more procedures, more chemotherapy, more radiation, where if you get it done right away, you're going to be out of the woods, hopefully a lot easier. And, the course of treatment, the time frame, the complication risk, the side effects all increase as you increase your time to get treated.
Yeah, and you bring up the early detection being key, and that's like Testicular Cancer Awareness Foundation. That's our big thing, is trying to get ahead of the guys who already have it and talk about, the self-exams. But interestingly, the National Preventative Task Force, or whatever it is, actually doesn't recommend self-exams because they, I think, believe that it does more harm than good to have somebody be kind of a hypochondriac about it.
I welcome anyone to touch their testicles every day. I can't tell you how many guys I see who come in because they are worried about something on their testicle. Most of the time, it's just their epididymis, truthfully. Which, the layman's term is like your testicle is your testicle where sperm is made, and then there's the crescent shape outside of your testicle where sperm leaves and matures. And oftentimes people can think that that's, they feel the head or the tail, which can be quite prominent in some people, and it can be misconstrued as a mass. I'm happy to see those people 10 out of 10 times if that's going to save one person's testicle or save one person's life from coming in. So from my standpoint, I say feel yourself up all day. If you don't want to do it, have your partner do it. Have fun with it. Do whatever you need to do. But I'm on your side on this one.
Yeah, thank you. Okay, so we're coming down the home stretch, 10-ish minutes left. So many guys talk about their testicular cancer being, quote, missed when they see the doctor, usually their GP or PCP. Should all urological concerns be referred to urology by a GP, PCP, regardless of what it is? This
is hard to answer because I think that, once again, there's issues with access to care. I don't think urologists, unfortunately, we're not everywhere. Well, I live in Miami, right? There's a lot of urologists here. Indiana has a good amount of urologists, but North Dakota, I don't know, like Idaho, I have no idea how many urologists in some of these places there are. So I don't think it's fair to necessarily say, should all testicle things be sent to a urologist, because the answer is, I don't need to see orchitis, which is an infection of your testicle, right? Usually a primary care, family medicine doctor. But I think that, if it is something that is a concern to you, and if your primary care is not doing what you feel is comfortable, one, you can always ask, and you should always ask for a urologist. Or two, you can also just ask for an ultrasound, right? Ultrasounds are pretty cheap, and they have no radiation, no side effects, and it's the best way to detect things. And even guys who I'm very convinced they don't have a testicular mass, if you're right, sometimes that fear is concerning. And I say to my patients, listen, I think this is a hydrocele, or I just think this, which is just fluid around your testicle, completely non-cancerous, or I think this is your epididymis, but I don't have x-ray vision. So I'm going to get an ultrasound to confirm it, even in those situations, because it puts them at ease, puts my mind at ease. It's very low risk. There's for a high reward for making everyone happy. So I think at the end of the day, if you can get to a urologist, that's great. If you can't, either try to find someone else in your area who's willing to accommodate, or at least ask for a scrotal ultrasound to confirm that everything is okay, like they said.
Nice. All right. So how can patients verify whether the medical advice they see online from these influencers we've talked about is legitimate or harmful?
This is really hard. It's getting harder and harder. So I did a study in 2000, I'd say about 3 years ago, 4 years ago. Man, I'm getting old. And what we did is we looked at men's health topics on Instagram and TikTok. We pretty much quantified, we looked at 5 topics, not cancer though. We looked at testosterone, erectile dysfunction, something called Peyronie's disease, male infertility, vasectomy, and semen retention, which is a whole topic in itself. But and we looked at what these videos were saying, who was saying it, and whether they were accurate or not. Less than, I think about 10% of these videos were given by healthcare provider, or about 10% were given by healthcare providers. The majority were not, and overall the data was horrible. Incredibly bad data. We also know on YouTube the most popular videos are often the least accurate videos, unfortunately. And so the question becomes, how do you identify a good video from a bad video? Well, the way I like to do it is, one, whenever I'm going online for health information, even myself, listen, we're all guilty of it, right? I ask myself, what am I looking for? What's my goal of getting here? Am I trying to find information on testicle cancer? Am I trying to find testicle cancer treatments, or learn more about my specific form of testicular cancer, learn about the surgery that I'm going to undergo, learn about a prosthesis, whether I should get it or not, learn about a chemotherapy option? And what am I going to do with that information? Am I just going to decide that that's the end of it? Or am I going to take this information to someone else and validate it, or talk with another person about it? So that's one. Two, who am I listening to right now? What is their background? Are they a patient? Are they who went through it? Are they a doctor? Are they a nurse practitioner? What kind of doctor are they? Are they a chiropractor? Are they like some random person who doesn't really have a background in this kind of stuff? Are they an oncologist? Are they a urologist? I think it's important you validate who this person is. The next question you have to ask is, what are they telling me, and what's their goal, right? Do they represent some business that they are pushing a product or pushing a specific thing? Are they there just to give you information? Are they there to, spike a controversy, and then all of those things, I think at the end of the day, you have to say, I'm going to go bring this to someone who I trust, a trusted resource, right? Before doing anything with this information. Because there's a lot of bad players online, and they're going to tell you things. And a lot of the keywords that you don't like, that you hear are red flags, is this happened to me, this worked for me. And I know from a patient advocacy standpoint, it's nice to hear that, right? But like, if you hear a patient say, hey, listen, I went on this diet and I never had to get surgery or chemo, that should be a red flag. It's like this, like if you hear this is what your doctors don't want you to know, that's probably a red flag. This worked for me. This is what people don't want you to know. Probably a red flag. Go to my website to purchase this product. That's probably a red flag. Because at best, you're spending money on a product that's not going to work. But at worst, you're potentially harming yourself by using that product or delaying your care, which can potentially harm you for other reasons. So I think anytime you have this information, you really need to have a reinforcement of it. You can go to your provider, come up with a list of questions or a list of topics or a list of videos. And I have this all the time. They go, hey, listen, this video I saw, blah, 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 says this. What do you think? I'm like, bullshit, not bullshit. I'll tell you right off the bat. But and there's good conversations come from that too. But there's other websites you can go to, right? Mayo has a great website. Hopkins has a great Johns Hopkins has a good. Those are legitimate institutions that provide very easy, digestible information, and that it's good information. So when in doubt, often try to use those kind of places. They have YouTubes. They probably have TikToks and Instagrams as well with information. And any advocacy group, obviously, that is part of that, the cancer or the disease state that you're part of is, I think, the best of the patient experiences there.
Yeah, and I was pretty adamant from the beginning on this podcast that we would have a disclaimer that, even though you're hearing somebody tell their story, make sure you talk to a doctor that you trust. You actually on Twitter or in X, I don't like calling it X, I like calling it Twitter.
Yeah, call it Twitter. I call it Twitter.
I'm old fashioned.
Yeah.
But I saw that you were actually blocked by one of those fake accounts, which is unfortunately kind of like a badge of honor because you're calling them out on their crap.
Oh, dude, I love that shit. I thought it was really fun because the truth is, a lot of these things now, I think they just came out with something on Twitter where you can see the country of origin for the account. Like a lot of these are just like bot farms that go use AI and create like these bullshit, either like pictures and threads just to get a lot of followers, to get a lot of money, through Twitter or through Instagram. And, it's funny because, like I said before, there is truths in there. There are accuracies, but that's the most dangerous thing where they slip in a couple dietary things or herbs or supplements at the end of the day, right? They build your trust to take advantage of it later. And my favorite thing is to just find these things and call them out on it. And I got blocked, and I'll probably continue to get blocked as I continue on this path because it's just important. And these accounts have hundreds of thousands of followers. Now, are they real or not? I don't know. But when you have that many, it still goes in your algorithm, right? I wasn't even following these guys, and it was just hitting my algorithm because I'm so in the topic, it's my job. So, you do have to be careful. Just because someone has a lot of followers doesn't mean that they actually know what they're talking about. And I've gotten a lot of vitriol from people, especially on Instagram and TikTok, calling out some BS stuff. And the bottom line is this, and I've already said it, is like, the cure to a lot of problems isn't some supplement or medication. Obviously for cancer, there's chemotherapy and surgeries and certain medications. But for a lot of these changes that people push online, they're not going to get the job done. It's not some over-the-counter beetroot kind of thing, or some weird movement you have to do 10 times a day to flush your lymphatics. Like, I've seen it all. It's all BS. Listen, a lot of this stuff can't hurt you, but, at the end of the day, I wouldn't waste your time or money on it until you talked with a provider about it.
You mentioned AI, and this is going to be my last question. And I know you had Dr. Cacciamani on your podcast as well.
Yeah, he's the man.
He's
the man. You should.
But, what are your thoughts on AI and its benefits or risks in the healthcare space for patients?
So I think that there's incredible value and opportunity for AI to be a great tool for both physicians and patients alike in the space. Now, understanding the risks and benefits, just like everything, is really important. We've done 2 studies so far looking at men's health topics. We asked 5 different AI platforms about testosterone, 10 questions on testosterone. And overall, they performed quite well, actually. Grok did the best, believe it or not. I think Bard was the worst, the new Google one. I forgot the name of it. It's not Genie or whatever it is, but Gemini, I think, was the worst one, actually. Bard did okay, and ChatGPT did okay, but there's still nuances to all of this that doesn't help, right? It's not good, and what you have to understand about the problem with ChatGPT and all these other AIs is like we're programmed to believe a computer, right? Like I immediately think that whatever this thing says is real. But when you get into the nitty-gritty, AI has something called hallucinations, right? Where they just make something up. If they don't know the answer, they just make something up. And you can see that when you ask it questions very deep in like a specific medical field, where it literally makes up citations, right? So that are not real, and it makes up data. So it takes a really astute mind who knows the research and knows the medicine behind it to really identify these things. So I think in generalities, it's quite helpful. But as we get into the nitty gritty, it's not. It's user beware for sure. There are better platforms for AI that are, you have to be a doctor to kind of access. But I also think interpretation of a lot of this stuff is difficult, right? Anyone can pull up a paper and be like, this supports my idea, but you don't understand what the paper actually says. So I mean, I'll give you an example. I got in an argument online about some kind of BS intervention that someone was trying to tell me was beneficial for testosterone, erectile dysfunction. And someone had the ability, right? Anyone can, and I said, show me the data. And someone clearly went on to AI and said, here's some paper, show me some papers that support this idea. And they sent me all the papers. The papers had half of them didn't exist. B, the other one, they weren't relevant to the actual topic. It's clear that these people don't know how to read the papers, and they're just trusting the AI to do the work. And it's funny because anything else we question online, if a doctor talks to you, you question it online. If a social media person, everyone's questioning everything. But when it comes to AI, we believe it to be true. And we're at a point where enough people know how to use it, know how to use it effectively, that you really have to take a step back and understand its weaknesses. So I say I welcome people to try to educate themselves and learn through ChatGPT and these other platforms. I'm doing it myself. But you have to understand the limitations. And if you're not really confident or you're not seeing something that you're liking, I think before you make any medical, decision, go bypass Dr. ChatGPT and go to a doctor before doing anything.
Yeah, you mentioned the hallucinations. There was actually a former guest on this podcast who asked if I could translate his episode for his Spanish-speaking family. And I put the transcript in, hoping to get Spanish transcripts, like a translated transcript. And I don't know much Spanish, but I looked at the output and I was like, you're making stuff up. This is not what I said. So very scary, but sometimes exciting with, what's possible. Yeah, and it can be a simple thing. I was in China, and I was using ChatGPT. I don't know why I should have used just Google Maps, but to navigate like the subway system for my path, and it just gave me a completely wrong direction to go. Cost me to be late for something about 20 minutes. And I asked, why did you lie to me? And it's like, oh, my bad. So like, and that wasn't a very complicated task, right? Like Google Maps can do that. So like these things can happen at a pretty simplistic level. And that time I delayed my day. Yeah. Final thoughts on misinformation in men's health and urology.
I think in general, men's health, testicular cancer, they're all under the same umbrella of highly stigmatized topics, right? Guys like to talk about their balls with their boys, but they don't like to talk about their boys with anyone else. They don't want to show their balls, understandably, to other people. They don't want to go to an office and announce to other people that they have a problem with their balls, their penis, their fertility, their energy, their libido. So what do? They just do nothing. They hide it. They suffer in silence. To quote the great Mo Cara, who, if you haven't had on, he's a wonderful guest as well. He's a urologist and a mentor of mine. So men suffer in silence, and sometimes the suffer in silence is just a quality of life metric, but it can be a true quantity of life metric when it comes to something like testicular cancer. So how do we overcome this stigma? Well, I think we have to understand that as men, it's okay to ask for help. We want to be, the voice of our family. We want to be the leaders of our families. A lot of men picture taking care of their partner, taking care of their kids, or just being, that leader in their job, or being that person that people can rely on. But you can't be any of those things if you don't take care of yourself and you don't, put yourself and your health in a place to succeed. So I think there has to be this mind shift saying that if I'm going to do the best I can as a partner, as a father, as a man, in my job, as a friend, I have to be the best person I can be. And that starts with my health. And so if you're having an issue, don't suffer in silence. Talk to someone. Talk to a primary care doctor. Talk to a urologist. Talk to a nurse practitioner. Whatever gets you in the door can definitely make a difference. And obviously, testicular cancer specifically can be scary, right? It's the most common cancer in young men, right? So when we're young, we think we're invincible. I'm now getting old where I feel that I'm not invincible. I can feel it in my body every day when I wake up. But, and we have this idea, it can't be me. It can't be me. It wouldn't happen to me. But the reality is, statistically, it's going to happen to some of us. And better to find out sooner than later, as we discussed. So if you see something, you feel something that's not right, go get it checked out. Because I'd rather have you come in, and I'm sure you'd rather have come in and me say, hey, this is nothing, don't worry about it, than ignore something that is actually bad.
Great advice. Where can people follow you to see you fighting the good fight against misinformation?
So I am on all social media platforms at Justin Dubin, MD, Justin Dubin, MD. And I also have a podcast, as you mentioned, Stephen, Man Up Podcast. That's on all podcasting platforms. You can find us on all socials as well at the Man Up Pod. Stephen, we'll have you come on, talk about your experiences and your journey. It's important that we continue to get patient perspectives with their journey. So we'll definitely have to have you on.
Yeah, I'd love to. And if you're still listening, leave a comment on YouTube about how good my ears look. I'm looking at them on the side here. I'm
really
like,
nice.
These are ugly ears.
Really nice ears.
Dr. Justin Dubin, thank you so much for being on It Takes Balls.
Thanks, man.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org.